The first case is a 53-year-old woman presented with cough, shortness of breath, and hemoptysis, as well as pain in the right side of her chest. She has really no significant past medical history. She's a never smoker, although she was exposed to some secondhand smoke as a child, but no other significant comorbidities. On physical examination, there was no remarkable findings. Her lungs were clear, and she had no other abnormal findings. Diagnostic workup included a chest X-ray showing multiple opacities in the right lung. This was followed by a chest, abdomen, and pelvis CT scan, which re-demonstrated several lung nodules in the right lung. A brain MRI was performed and unfortunately showed extensive metastatic disease. Biopsy of one of the right lung nodules was positive for lung adenocarcinoma. This was subsequently sent off for molecular testing, which included EGFR, HER2, BRAF, KRAS, RET, and ROS1 FISH. Those were all negative, and ALK-IHC was notably positive, and a PD-L1 score of 20% was observed. I would say that there is no typical ALK-positive patient. This is a woman of middle age, a 53-year-old woman. She's a never smoker, and while we consider ALK positivity to be associated with never smokers, that is statistically true, but it's really important to note that patients who are former or current smokers can also be ALK positive, and so that testing of all patients with lung adenocarcinoma and non-small cell lung cancer, really, as we identify ALK positivity and rarely in squamous cell and other histologies, is important. And so I think although there's this conventional wisdom that patients who are ALK positive are younger and never smokers, that shouldn't prevent testing of older patients who are also smokers and also have other histologies. Fortunately, the prognosis for ALK-positive patients is now quite good. We know from several long-term retrospective analysis that the overall survival for ALK-positive patients can easily stretch into years, and in some cases well over 5 years. And so this has really changed the way that we think about certain patients with lung adenocarcinoma, especially those with genetic drivers such as an ALK rearrangement. Because there are so many effective therapies, these patients can really do well and lead a relatively normal life for often many years.